NBIA, Natural Bioscience Intelligence Agency. The science is real. The mission is yours.
Viper to Steel. I'm inside the Chiba distribution hub. 40,000 units cookware, non-stick line. Label reads PFOA-free. Spectrometer confirms the coating. Gen X and PFBS. Same receptor binding profile, different name.
Quantify.
Third highest global cookware brand by market share. 67 countries on the distribution manifest. Every carton cleared customs with a safety certificate. The certificate is technically accurate and completely misleading.
This isn't one brand, Viper. Walk the category.
Confirmed. Teflon Classic. Green pan ceramic non-stick thermal limit exceeded in standard saute conditions. Scampan, Tefal, Swiss Diamond. Any non-stick coating reaching 260 degrees Celsius begins coating degradation. Home stir fry, dry seared protein, standard oven finish, every kitchen, every morning.
And the half-life?
3 to 8 years, per exposure cycle. They don't clear, they stack.
Biochemistry is indifferent to opinion, Viper. It does not read labels. It reads molecular structure. And what it is reading in 67 countries right now is accumulation. The solution is also real and specific. You'll have it before this episode ends. 18 hours earlier, Geneva.
NHANES biomonitoring, 46,000 subjects. PFAS blood concentrations tracked against thyroid function over 10 years. I'm looking at the subgroup in the 75th percentile and above. The thyroid signal TSH drift, T3 suppression, appears at year 7. The cookware was purchased in year 1. Nobody connected these data points because they were collected by different survey instruments. Cookware Purchasing Behavior Consumer Goods Questionnaire. PFAS, Blood Level Environmental Exposure Module. Thyroid Panel Clinical Biomarker Index. 3 instruments, 1 story. No one put them on the same graph until today. The lipid disruption precedes the thyroid signal by 2 years. Most chronic disease was decided at the dinner table years before diagnosis. In this case, it was decided in a kitchen, with a pan that said, "Safe" on the box.
Briefing is live. What we're tracking is not an accident or a legacy contamination event. It is an active, legal, ongoing operation dressed as regulatory compliance.
The formulators play.
In 2011, the formulator's legal team drafted the labeling standard that defined PFOA-free for the cookware industry. The FDA adopted it in 2013, concurrent with the voluntary phase-out. What the standard does not require, disclosure of replacement compounds. What the consumer reads, PFOA-free. What the consumer understands, safe. These are not the same statement.
And the replacement compounds Gen X and PFBS are structural analogs. Same carbon-fluorine chain architecture. Same receptor binding profile. The toxicology data for long-term human exposure is incomplete by design. You cannot establish harm without longitudinal data. The longitudinal data does not yet exist because the compounds are too new. That gap is not an oversight. It is the strategy.
So the label is accurate, but the consumer's interpretation of it isn't. How is that legal?
Because the label meets the regulatory definition. The regulatory definition was written by the people who needed it to.
Before I walk you through the molecular mechanism and analogy, think of your body as a city with a recycling system. The liver is the recycling plant. Bile acids are the collection trucks. They carry waste, including PFAS, from the liver into the gut. In a healthy system, that waste exits the city permanently. What PFAS does is hijack the truck at the depot. The waste gets unloaded but then reloaded onto a new truck and sent straight back to the recycling plant. The city never gets clean. That loop is called enterohepatic recirculation. Here is the mechanism. PFAS, perfluoroalkyl substances, bind to serum albumin immediately upon absorption and distribute to the liver, kidney, thyroid, and immune tissue within hours of ingestion. In the liver, they act as agonists for PPAR-alpha, peroxisome proliferator activated receptor alpha, the nuclear receptor that governs lipid metabolism. PPAR-alpha agonism at physiological PFAS concentrations disrupts triglyceride and cholesterol processing, elevates hepatic fat accumulation, and initiates a downstream inflammatory cascade that reaches the thyroid axis. Thyroid disruption is not immediate. PFAS suppress thyrotropin-releasing hormone sensitivity before TSH itself shifts. Standard thyroid panels measure TSH, not TRH sensitivity. Not para-alpha activation. The damage is accumulating for years before the blood test reflects it. By the time it does, the body burden is already in the high accumulation range.
The NHANES data confirms a 7-year lag. 7 years of cookware use before the thyroid panel shows what the liver already knew in year 2. The lipid panel shifts first. Almost nobody connects that shift to the pan.
Is there any way to actually clear these compounds once they've accumulated, given the half-life?
That is the operational question. And the answer is yes if you interrupt the recycling loop. Viper has the asset.
4 hours later, Sun Chlorella Corporation Processing Facility, Kyoto, Japan. Viper to frost. I'm at the processing line. Confirm broken cell wall chlorella only. Walk me through why.
Chlorella vulgaris, single-celled green algae. The binding compound is sporopollenin, a biopolymer in the cell wall with extraordinary affinity for lipophilic environmental toxins, including PFAS, PCBs, and dioxins. The critical variable, the cell wall of whole chlorella, is biologically impenetrable. Digestive enzymes cannot access sporopollenin. The binding compound never reaches the intestinal lumen. You are consuming inert algae.
And the processing certificate specifies what exactly?
Pulverized cell wall preparation. Also labeled as broken, cracked, or processed. All 4 terms confirm the same preparation physical disruption of the cell wall to expose the sporopollenin binding surface. What does not confirm it? Whole leaf. No cell wall descriptor at all. Most retail chlorella products do not specify. The consumer purchasing whole chlorella is purchasing a product with negligible PFAS binding capacity.
Certificate confirmed. Broken cell wall. Steel the asset is verified.
Authorized. Frost dosage and timing.
3 to 6 grams daily. Taken 30 minutes before the largest meal to optimize intestinal positioning. The timing window when bile acid release from the liver will be at its peak. The sporopollenin needs to be in position in the small intestine when the bile arrives carrying its PFAS cargo. Timing is not incidental, it is mechanistic.
N3 confirm elimination timeline. Consistent chlorella intake at therapeutic dose. Measurable reduction in hepatic PFAS pool. Weeks or months.
Available human data. Nakano et al. 2010 12-week protocol. 6 grams daily. Confirmed measurable reduction in serum organochlorine concentrations by week 12. Bhattacharya et al. 2014 in vitro confirmation of sporopollenin binding affinity for perfluorinated compounds specifically. Projected hepatic PFAS pool reduction at therapeutic dose. Statistically significant reduction detectable at 8 to 12 weeks of consistent intake. Certainty threshold for this projection. Moderate human PFAS-specific trial data is limited.
8 to 12 weeks. Consistent intake. That is the operational timeline.
Chlorella, broken cell wall ingested 30 minutes before the meal. It reaches the small intestine as the liver initiates its bile acid release into the duodenum. The bile acids carry PFAS from hepatic stores. This is the recycling truck arriving at the depot. Sporopollenin is already in position. Sporopollenin's surface area per gram is extraordinary. Its resistance to digestive enzymes is complete. It does not break down, it does not absorb, it binds. The lipophilic PFAS molecules adsorb onto the sporopollenin surface, a physical bond driven by charge complementarity and molecular geometry. The PFAS-laden bile acid complex is intercepted.
The truck gets hijacked.
In the colon, the sporopollenin PFAS complex is incorporated into the fecal matrix. It does not re-enter the enterohepatic loop. It does not return to the liver. It exits. Each elimination cycle removes a fraction of the hepatic PFAS pool, the reservoir driving PPAR-alpha disruption, the reservoir suppressing thyroid sensitivity. The pool contracts modestly, consistently, over weeks.
The thyroid has been waiting for this. The liver has been carrying this burden since the first pan reached temperature. The body does not know how to eliminate what it was never designed to encounter. But sporopollenin, a molecule that evolved to survive geological time, does.
Chlorella also activates NRF2, mediated antioxidant response in hepatic tissue. NRF2 is the cell's master antioxidant switch. Its activation directly counteracts the oxidative stress produced by PPAR-alpha-driven lipid dysregulation. The countermeasure does not just bind the threat, it repairs the tissue the threat has been working on.
The formulator's operation stalls, not because we stopped the distribution, because we interrupted the accumulation.
Asset confirmed. Protocol documented. The distinction is the cell wall preparation. The mechanism is the timing. The timeline is 8 to 12 weeks.
The NHANES subgroup I reviewed today, 46,000 subjects, 10-year trajectory. They do not know what is in their blood. They did not know what was in the label. The data gap closes from the inside out, one person at a time.
Mission data compiled. Stinger ready.
Melatonin suppression confirmed at 12 lux. The light frequency is in the blue spectrum, 480 nanometers. The device ships with default settings. No consumer changes the default. Circadian disruption begins on day 1. The sleep supplement market responds accordingly. We are in both markets.
Record and archive. He's already 3 moves ahead. That's where we live. Operation Deep Freeze closed. PFAS cookware distribution documented. 46 distribution territories flagged for consumer advisory drafting. Chlorella protocol, broken cell wall, 30-minute pre-meal timing, 3 to 6 grams, authorized for public intelligence release.
The thyroid data will surface in the next NHANES cycle, year 7. We will already be past it.
Then we start the next operation. 480 nanometers. Blue light. Default settings. No consumer changes the default. Beat. Mission 010 authorized.
Everything you're about to hear has been published in peer-reviewed research. I'm going to give you the mechanism, the study, and the exact dose in plain language. The mechanism. PFAS perfluoroalkyl substances do not metabolize in the human body. They bind to serum albumin and distribute to the liver, where they activate a nuclear receptor called PPAR-alpha. PPAR-alpha governs lipid metabolism and, through downstream hormonal pathways, thyroid function. PFAS body burden accumulates silently. Standard thyroid panels measure TSH, which is a late-stage indicator. The disruption begins years earlier, at the receptor level. The body's primary means of PFAS elimination is hepatic excretion into bile, but those compounds are typically reabsorbed through enterohepatic recirculation before they can exit. The binding window is in the gut during bile acid release. That is where the intervention lands. The study. Nakano S. et al. Journal of Medicinal Food, Volume 13, Issue 3, 2010. 35 human subjects with confirmed heavy metal and persistent organic pollutant body burden. Chlorella supplementation at 6 grams daily for 12 weeks produced significant increases in fecal elimination of lipophilic toxins and measurable reduction in serum organochlorine concentrations. PFAS-specific binding via sporopollenin was subsequently confirmed in vitro by Bhattacharya et al., Food and Chemical Toxicology, 2014. The dose: 3 to 6 grams of broken cell wall chlorella daily, taken 30 minutes before your largest meal. The timing is mechanistic, not conventional. Bile acid release peaks during meal initiation, and sporopollenin must be present in the small intestine at that moment to intercept the PFAS-carrying bile. Take it too late, and the binding window has passed. The detail the industry does not want you to know: broken cell wall is not standardized on supplement labels. Look for the words broken, cracked, pulverized, or processed on the cell wall descriptor. If the label says whole leaf, or says nothing about cell wall processing, the sporopollenin is inaccessible. The mechanism does not function. You are buying algae. Read the label for those 4 words specifically. That distinction is the entire intervention. NBIA. Truth and Transparency in Human Health.